cervical vertigo, which means the patient suffering from this, whenever he or she moves her head in extreme positions, they have a spinning sensation. For a normal balancing system, the following parts which I am going to mention, these have got to be intact. These include knee joint, related muscles, nerves, skin, neck, ears, eyes, and cerebellum. The cerebellum form part of the central nervous system. So, if you must have noticed, I mentioned about neck. The importance of neck is that the blood supply to the posterior part of the brain and both the ears, the artery which starts from the heart, it goes inside the bone of the neck, which is a cervical vertebrae. So I'll show you a picture as well as a video so that you can understand better. So in this picture you can see these are the neck bones, and the artery, it goes inside a small foramen or opening here. So likewise you have on this side also. I'll show you a video also where here you can see that small nerves coming out on all sides, and here you can see a red structure which is going inside the foramen, and both arteries on either side, it joins here. So if there is any neck related or bone related, this system related problem, if there is a wear and tear of the bone, or there is a joint problem, or there is a disc problem, what will happen is, whenever there is neck movement, you can have kinking of this artery and the blood supply can be compromised. Likewise, the joint sensation need to be normal, and it can have a direct effect when it compresses the nerve also. So, what is the reason for this? The most common two reasons are trauma or accident. The second common being cervical spondylosis. I'll put the cervical spondylosis as the first common one. Now, the reason for vertigo I have already mentioned. It can be because of intermittent vertebral artery compression, or it can be altered sensation feedback from the neck joints, and the last being cervical cord or the neck nerves related compression. And the complaint of the patient will be, like how I mentioned before, that whenever they have neck movements, they experience vertigo, and they'll give a history of trauma, or they give a history of neck pain which is there for a long time, and they have been consulting orthopedician or neurosurgeon for that. So as far as an ENT examination is there concerned, the nose, ear, throat, everything will be normal, but there will be restricted movements of the neck, especially more than 30 to 40 degrees. They will not be able to move the neck freely. Now, coming to diagnosis, a simple test will come to know whether it may be related to this or not. So if you see this video, we'll make the patient seated like this, and holding the head, we'll ask the patient to turn the body, like how it is demonstrated here. So what happens is, if the patient has got cervical problem, the patient will experience giddiness, and they'll have eye movements also. To diagnose this, imaging wise, we need a CT scan with angiography, or MRI with MRA, or Doppler scan neck, which can be of help. Now, coming to the main purpose of this video, that is the management. The idea is, as this is patient teaching program, I will not be mentioning anything about the medications. My main idea is to train you and tell you a few exercises which can be done at home. And if it doesn't work out well for you, you have to visit a physiotherapy, and what you can expect the physiotherapy to do. Now, if suppose the patient has got migraine, it's better that we treat migraine at the same time. So, to start with, the body position. See, 5 pictures I have shown you. See the first one, which is normal, the head being straight, which is rarely possible. And when you start bending the neck, For 15 degrees, you feel as if 12 kilos of weight is placed on your head. So for next 15 degrees, that is 30 degrees, you feel as if 17 kilo is placed on your head. For 45, it is 22 kilos, and for 60 degrees, it is 27. What happens is, nowadays, most often it is seen that after heavy work, for relaxation, most of the persons or they lie down on the bed, and the last two positions, 45 degrees, 60 degrees, they lie down on the bed and watch movies or they play games in the phone, and the neck position will be like this. So this being done for a long time, it can affect the neck and the related structures that can lead to cervical problem, which can in turn lead to vertigo. Now coming to exercises. So first I'll tell you the exercises which can be done at home. Have a look. So place a hand in front and ask to them to push it. So that has to be done 10 to 15 times. Place a hand behind, ask them to push 10 to 15 times. Likewise on the right side, 1, 2, 3. Likewise on the other side. So this will strengthen the muscles around the neck. Now coming to the next exercise. Have a look. Turn your head to the right and left. Repeat that for 10 or 15 times. Likewise up and down. Repeat for 10 or 15 times. Then clockwise and anti-clockwise direction. Repeat that for 10 or 15 times. Turn your head to the right side. Look up and down 10 or 15 times. Likewise on the left side. So this is the second exercise which can be done at home. Now coming to the third exercise. Stretch both your arms, bend your neck as much as possible. There will be slight pain also. Stay in that position for 10 seconds. Repeat that for 10 or 15 times. Once this is done, you can do this also as much as possible. Then you bend your neck. Move your fingers or hands as much as possible. Bend your neck. You'll experience slight pain. So all these three exercises put together, done each session will take hardly 10 to 12 minutes. That's all. Now, if you are not feeling better with this, you need to consult a physiotherapist. The physiotherapist, I'll tell you what you can expect from the physiotherapist. What you're going to do is, it will be warm application, ultrasonography of the neck, then TENS therapy, transcutaneous electrical nerve stimulation, and releasing of trigger points. I'll explain each one of them. To start with, warm application. So each warm application, it takes about, you'll have to place it for at least 10 to 15 minutes. After preparing this, wrap it up properly so that it is not getting overheated. And we'll check the temperature also. It is kept at a particular temperature, so we don't have to worry about that. And it will be placed in the neck for at least 10 to 15 minutes. And totally we need 5 sessions. The next one is going to be ultrasonography. And this also will take nearly 5 minutes. And we need at least 5 sessions for acute pain and maybe 10 or more than that for chronic pain. The third being releasing trigger points. The physiotherapist will massage the neck and find out the tender points and she will keep on massaging that particular area where it is very painful to release that trigger points. So this has to be done at least for 5 to 7 minutes, and it has to be repeated also. The last being tense therapy. We'll place these gadgets properly, and minimal controlled amount of current will be passed through, and that will go on for at least 10 minutes. For acute pain, it is 5 sessions, and for chronic pain, it's about 10 sessions. So this is how we manage a case of cervical vertigo. So to brief in this video, I'm concentrating mainly on exercise, home exercise, what all can be done, and if not controlled, how the physiotherapist can help you. Most of the patients who come to me, or those who consult ENT, they'll be already on analgesics, painkillers. When you do these exercises, the painkiller dose can be reduced. And some patients, not only painkiller, they'll be taking the next generation medicine like even anticonvulsants. All this medicine dosage can be reduced. And this has to be done regularly. Once you improve, that time please do not stop it. You continue your exercises so that the condition does not get aggravated. Thank you so much.